If you take any patient with pancreatic cancer and you ask them if there's somebody else in the family with the disease, it turns about 10% of the time that someone else in the family will have a positive history of pancreatic cancer. So if you have one family member with pancreatic cancer and you're a first-degree relative, your personal lifetime risk is less than 1%. So that is very low. So you are very unlikely to get pancreatic cancer, very unlikely. If, however, there are 2 or more family members with pancreatic cancer, your personal lifetime risk actually goes up to 4%. If one family member has pancreatic cancer in your family, then your lifetime risk as a first-degree relative would be 12% of having some other kind of cancer, colon cancer, breast cancer, lung cancer. If there are 2 or more family members, your lifetime risk of getting some other kind of cancer is 27%, so it's very high. So we need to be on the alert to be thinking, I don't want to just save you pancreas cancer, I want to save you from all the cancers. So we talk about what are the risk factors for those family members, how do we identify precancer, and what do we do about it once we find the precancer present. So in my laboratory, we did some studies and we looked at 251 patients and out of 28 families, and we looked at their personal risk of how that would be affected by smoking, by diabetes, their gender, male or female, and the number of affected family members. And it turns out that all of these are important except for gender. Smokers are more likely to get the disease, and not only are they more likely to get the disease, but they get it a decade earlier. So this is the age of onset, and this is your risk of pancreatic cancer. And you can see here that these people who smoke get it 10 years before other family members do. We're all working toward earlier detection, better methods for treatment, as well as improving the survival of the patients. And as our knowledge of the disease has grown, I think that we are leveraging that to get at these endpoints. I really feel like we have come to a very good point in our journey where things are starting to pay off clinically. Thank you very much.